Good afternoon. Welcome to 𝐻𝐿𝐻 Academy Reading Live. I am Vinod James. Welcome to another session. Tuesday, is it? All of you were eagerly waiting for us. We would never leave you empty-handed, isn't it? Right, so welcome to another session. And just what is the most important thing that is happening this weekend? 𝐻𝐿𝐻 Madam is going to come live this Friday. So please do not hesitate. Do keep your reminder. Do clock in. The very same page that you're watching, 10 p.m. Indian Standard Time. Okay, we all will be expecting you there. Really looking forward to welcome you all there at that time. Okay, so do not forget the very same page that you're watching. Please do pop in. Now, that's also another reason why you're asked to like the page. Because if you like it, so that what happened, you would not miss all the updates, would be regularly coming on the aspect of whenever that we come up with a live, we come up with a new insight, we come up with a new information, you will not miss it. Shiny Sojan, good evening. Very nice to see all of you. Right, as students are popping up, what are the things 𝐻𝐿𝐻 Academy has in stores for you? We do have an array of linguistic training that we give. If you want any insight, please do not hesitate to contact the number which is there on the screen. They'll be happy to assist you. Monica Vegas, good afternoon. 𝐼श्वर्या Satishan, good afternoon. Arun Ravi, good evening. Sophia Agasti, good afternoon. Kalpana, Manipur, good afternoon. Shiny Sojan, good afternoon. KS, Reshma, hi. Savit Biju, good afternoon. Very nice to see a lot of known students, few unknown names. If there is anybody who's attending the live for the very first time, please do not hesitate to let me know that you're attending for the first time and also where you're attending from, because I love to say that I have known people across the globe. Jilmi Joy, good afternoon. Shivanya Nidish, good afternoon. Evening. So if you have not yet liked our page, please do click the like button. If you have not yet followed, please do click the follow button. If you have not yet subscribed to our channels, please do not hesitate to subscribe to our channel. Why? These are all for your benefit. So when you do that, so that no fraudulent people will come in between, intervene, so that you will have no problem. That's why we come and tell on the live. GB Varghese, good afternoon. Jinsi Jiskaria, good afternoon. Manisha, good afternoon. Jean Bino, good afternoon. Shivjanaj, good morning. A very good morning. Hope you are enjoying your lovely life in UK. Yes, so nice. Very kind enough of you to come and say that sweet gesture. Enjoy your lovely life. I'm sure that you're enjoying your lovely life with your family. Shivanya, first time, very nice. Shivanya, may I know where you're from? Sidhu, good afternoon, Bangalore. Fair enough. So if you have not yet joined, why? Because we'll be pinning the social media platform that 𝐻𝐿𝐻 Academy are available. So you are always welcome. And these are all free access for you. Okay. So if anybody asks you for any other reason, tell them no, because just block them. I'm telling you straight on the live. Ashwati Sachus, good afternoon. I'm telling you, please do not message or don't go behind any fraudulent messages that is coming your way, because those are not from us. Okay. Surya Susan, good afternoon. Kavita Balaji, good afternoon. Tansi, good afternoon. Shivanya Palakar, okay, very nice. I have a lot of things attached to Palakkad. So fair enough. Nice to know that I have another person from Palakkad. Sandhya Bijoy, good afternoon. Shiny VS, good afternoon. Fair enough. And as you can see, 𝐻𝐿𝐻 Madam is going to come with her new self-prepared writing depiction case note. So please do clock in. Anjali Devdattan, good afternoon. Josmi Jos, good afternoon. Shiny VS, good afternoon. Clarina Fernandez, hi. So no matter wherever you are from, whichever part of the world are you from, a very good morning, a very good afternoon, and a very good evening to all my lovely students. Hope you're all getting benefited out of it. Yes, if you feel that my classes are beneficial, please do not hesitate to share the very same link on your social media platform, because I definitely look into the aspect of how many of you have shared. Because when you share, that means you feel that my classes are going to be beneficial not only for you, but also for someone else, isn't it? So that is the reason why you share. So if you feel that, please do. That's how I gauge because when I ask you, see, it's not that you don't give me a valid feedback, but of course, I would always assess because these are the indirect way that you can assess where your classes are. Shani Joy, good afternoon. Gina Benish, Kakanad. Okay, fair enough. Okay, thank you very much, Monica. See, these are all the fraudulent people available. So please do not respond. Just report them and block them. That's the only thing. We have to be careful. So please be aware of it, because if you start, we always believe in your hard working effort. You all have that capability to get over that line. So you don't need any of these fraudulent people's any help. Just put in your hard work. You will definitely see all those, the benefit that is there. And you will always feel proud when you get out of what is your effort, not by such kind of fraudulent people. Okay. So Kavita, good afternoon. Ajish, good afternoon. Very, very, very nice. So I think I have one person only today who's attending new and who's from Palakkad. Good enough. So are you all ready for today's session? If so, give me a quick thumbs up. Let me see how many of you are eagerly waiting for today's thumbs up. And also, see, please be kind enough to correspond, isn't it? The only way that I could gauge is up to on the aspect of whether whatever that I'm telling you, I'm teaching you, you are benefited is by your valid response. So if you want to communicate, please do not hesitate to type. I'll be happy to assist you. Nisha Chako, good afternoon. Kavita Reddy, Arun Ravi, good enough, good enough. Christina Reddy, I'm sorry, good afternoon. Neetu Unnikrishnan, good afternoon. Surya Susan, Reddy, good enough. Shiny VS Reddy, good. Karuna, good afternoon. Sophia Agasti, ready. Anija, ready. Christina, ready. Nice. Asha James, good afternoon. Shivanya, my new student from Palakkad, isn't it? Good. Sharat Chandran, good afternoon. Tansi, ready. GB Varghese, ready. Rasna Suraj, ready. Grishma Devasya, good afternoon. I'd love to see at least one icon next to you, because it's all there. It can be heart shape, it can be a flag, it can be a hand, it can be a share button, you name it. That's how you have been supporting us. Thank you so much for all those supports that you have rendered, because without you, we would never be in here, isn't it? Whatever that we are doing is all because of your valid feedback. So please do not hesitate to let us know how you feel. Whatever that you want, please do let us know. We will definitely look into. Jean Bino ready, Kavita ready, Josmi ready. So as all of you are ready, now let's go and see what part B is there for you. So when you're doing part B, what you have to always remember is try to find an answer on or before the time exhausts. Okay, so you have to just go through it, find an answer. Once you have found an answer, do not worry, just put a thumbs up saying done, or you say done. Either don't type the answers, because when you type the answers, what happens is another student who is not yet into the answer, they might be misled, isn't it? They might focus on what you are saying. So please don't, because the whole idea of we always believe is we are all family. So make sure that we are helping each other. Okay, Linta Botin, good afternoon. Tanga Sudha, good afternoon. Sandhya Bijoy, ready. So another few insights on the aspect. See, always ensure that there is always a problem with most of the students is they keep on changing the answers. Okay, see, you don't have to do that. So today's tip you have to always remember is do not change the answers until and unless, I'm not saying no, but most of the time, 99% of your time, your first answer would be the most appropriate one. You do change as long as you're sure that your second answer is 200%. If not, stick to your first answer. Again, this is only suggestion, okay? Because this is according to me. Because when I was doing, it's always my first answer was right. So I thought, yeah, it is fair enough to let my students know. Because whatever I feel it is beneficial, I'm just gonna. Ramya Harish, good afternoon, sir. I didn't clear, but I got reading, speaking B, listening, writing C+, your reading class, really helpful. Ramya, I'm very, very, very happy that you have that courage to come and accept where you are, isn't it? Now, please be kind enough to know me as a person is just only a bridge, but it is absolutely your hard work that has reached you. But I'm sure, let me be very straight to you, because God has a better score for you. Mark my word, the very next exam that you're going to write, you will see wonders in that result. Okay, and then you're going to come and tell me, I have made to my dream with a stunning score. All right. Do keep focused, do practice, do keep your habits. It'll all be there for you. All right. Ramya, I really adore your, what do you can say, your heartfelt feeling that you had for us. I always appreciate a student who has that courage to come and tell. See, when a student comes and tells whatever they are going through, that's the most brilliant part of it. A student is ready to accept that change and going and really looking forward for a fruitful life. Kalei, good afternoon. Missing your classes? I'm always here, isn't it? So whenever you feel that you're missing, please do pop in. I'll be here. Atira Sally, good afternoon. It is all because of all of you who are our lovely students, because of your love, care, passion, commitment, your effort. That is making us more enthusiastic coming in front of you on a daily basis. So don't take anything away from each one of you. You're all being absolutely stunning. All right. So a big love and affection from all of us from Neethu's family. Because of you, we are in here. Sanil Nair, good afternoon. So as you said that you're all ready, the material will be popping up on the screen. As soon as the material pops up, do not waste your valuable time. Do the material as quickly as possible. Always when a material comes in front of you, always consider, okay, what if it is my exam material? Like that. There you have the material. Please do the material and then we will discuss. So nice to hear that, the comments and all are coming before, on or before time. I could see Shiny V as the first comment which said done was about more than 30 seconds on. Good enough. Tansy done, Kalhi done, Josmi done, Neetu George done, Anija Devdattin done, Shiny done. Good enough. Tangasuda done. Fair enough. Betsy, UK, good afternoon. Betsy done. Okay. Sarat Chandran done. Good enough. Kalpana, Manipur done. Jean Bino done. Shivanya Palaka done. Christina done. Sophia done. Good. Now, would you be kind enough to tell me what is your answer? And most importantly, where you got that answer from? That where is very important. Sandhya done, Jinsi done, Karuna done, Shani done, good, 𝐺𝐵 is done. So tell me, Kavita Balaji done. If you have not yet liked our page, please do not hesitate, because I would like to request all of you to have at least one icon next to your name. That shows that how much of a support that you're rendering towards us. Fair enough. Arun Ravi done, Nisha Chako done. Neetu George, the first one to say A from second paragraph, first sentence. Okay, fair enough. Now I have my first answer there. Kalai, I got A from middle part of the para. Akila done. Christina, A from middle. Shiny Sojan, B from second para. Jean Bino, C from last para. Am I happy? All those three answers are a possibility. So I was expecting all the three. So I have all the three. Now, quite happy. Why? Because as a trainer, because the most fruitful thing when a student says all the answers is because they are true to themselves. That's what I gauge. You know why? Because it's not just, see, as a student, you're not here to only say right answers. You are here to learn. You should say all those answers that you've got. Fair enough. Okay. So I have a few other options. Arun C, Savid B, second para, Sharad C, last para, Betsy A from second para, Josmi A from second para, Akila B, Tangasuda A from middle, Thansi A from middle, Reshma B from second para, Shani A from second para, 𝐺𝐵 A from middle, Josmi B second para, Sophia C from middle, Sandhya Bijoy A from second para, Anija C last para. So these are the all the things are a possibility, isn't it? That's why you have to know where that mistakes are. That's the important thing of learning. So, but generally what happens, the student is not ready, but you are all absolutely ready. So that's the difference between a student with a purpose. We can easily gauge. See, when I tell my students in the class, I really don't believe that you're sitting in a class just to relax. See, whenever you go, I don't know whether you are doing that or not. If not, please do. Whenever you're being sent to a training class, whenever, you should always carry a pen and a paper with you. Now, why that is? Because you might be an affluent person in that particular area that you're going for training. See, the training is done to enhance it. See, don't think that, okay, everything I know, it's not going to work like that. See, you have to see, even if it is a word, you should be happy enough saying that, see, I got a new insight. That's called the power of learning. Okay, I missed a few. Sandhya Bijoy A, Anija C, Kavita, Jinsi's career B, Nino Vincent B, Manisha middle para, Ajish couldn't complete mindset. See, I do understand. Ajish, see, thank you very much for letting me know that one also. See, these are the possibilities on the day of exam also. Okay, so what I want you to do is, I want you to take that particular thing as a positive thing. So what happens? You should try to give an answer, even when the other things are not going right for us. Because on the day of exam, it might be a problem. It might be, I'm not saying no. So what happens when you have already encountered that problem, on the day of the exam, even if it happens, you're not going to panic. That's how you make the most out of it. Okay. So I do understand that might be something that is not correct for us. Who else or who doesn't have a problem, isn't it? So our job is to learn on the aspect of how to jump over the problem. Because the whole reason why you are trying to attend and clear this exam is to make sure that I'm not saying all the problems will suddenly vanish. It is gonna be eliminated. Nisha Chako C, Surya Susan B, Sheena Korean, unborn baby fetus. Okay. Manisha B, Manisha, sir. Okay, fair enough. Now let's see what is the answer and how you have derived the answer and how or what is the right answer. Is it A, is it B, or is it C? See, in order to get the answer, the first and the foremost important thing that you have to do when doing part B is make sure that you're reading the question, underlining the keywords in the question, understanding the question. If you understand the question and underline those keywords, that is very, very important. See, students still doesn't understand the importance of keywords. Okay, not you, generally, okay. They simply underline for the sake of underlining. Every time when I take my class, when I ask my student what are the keywords, they simply tell for my sake. But they don't realize it. See, when you don't underline a proper keyword, Who is getting the answer wrong, you or me? Be aware of it. Now let's go and see what can be the important keyword. So which of these is a, now see there's a word called certain there. That means this is one of the most important things. Certain side effect means that is one which is for sure to happen when using cyclophosphamide. So certain side effect. Cyclophosphamide is a heading, so you really don't have to worry. So these are my two keywords, certain side effect. So that means the most prominent side effect that happens when you're using cyclophosphamide. Now read. Certain side effect is, the most important one is fetus adversely affected. Or is it certain side effect is the production of the ova and the sperm declines? So production declines. Is it the certain side effect is the nursing baby seriously harmed? Now, nursing baby seriously harmed. So that is also another thing that you have to really look into. Now, cyclophosphamide. So cyclophosphamide is a prescription medicine used alone or in combination with other medications to treat several types of cancer, including lymphoma, leukemia, ovarian, and breast cancer. So where is cyclophosphamide used? In combo or as such. It has also been used to treat minimal change nephrotic syndrome, a kidney disease, when other treatments have failed. So this is also used for such other conditions when the other alternative methods are not benefited. Now going back, so nothing to do with the given three answer options. Okay. Now pregnancy. So this is called, I forgot to mention, elimination method is what I always believe, and this is how I eliminate. So first paragraph has nothing to do with anything to do. If it is as such mentioned, keep it like that. If it is not mentioned, don't worry about it. If it's opposite mentioned, eliminate it. So that's how you eliminate. Pregnancy should be avoided during the cyclophosphamide treatment. So they're clearly saying pregnancy should be avoided when you are under this treatment. Cyclophosphamide, why? Now they are giving you an explanation of the aspect why it should be avoided. Has been shown to be harmful to the unborn baby when taken by pregnant women. So fetus is adversely affected. So slightly pointing into B. Okay. Tell your doctor if you're pregnant or plan to become pregnant while receiving cyclophosphamide. If you become pregnant during the treatments, tell your doctor right away. So these are all because why? It has an adverse effect in your fetus. So that is a certain side effect, isn't it? The certain side effect. Now, this medication may also affect the fertility. So now this is the problem. May also affect. This is called a way to say possibility. Okay, it is not confirming. So certain means most definite. This is only a possibility. Now what happened with that is you have literally searched, okay, fertility, men, women, reducing sperm egg. So decline, reduction, reducing. Sperm ovum, it mentioned. Then production. This is not keyword reference. You have to understand the sentence. Understood? So may also is not a certain side effect. Possibility. So this is definitely eliminated. Okay. Now reading. Cyclophosphamide is excreted in breast milk because of the potential for serious harm to nursing baby. Do not take cyclophosphamide without talking to your doctor if you are breastfeeding. So nursing baby is seriously harmed is not mentioned. They are saying it is cyclophosphamide because under treatment it is excreted in breast milk. So because of the potential harm to nursing baby, do not take. So it is not because the nursing baby is seriously harmed, that is a side effect. It can, see, that is not a side effect, isn't it? So what you should do, you are not supposed to take cyclophosphamide without talking to the doctor. That's all what they said. It is not because it is a side effect, nursing baby is seriously harmed. No. Understood? They are saying you cannot take, see the sentence you have to understand, the meaning. Here it is not because the side effect is serious harm to the nursing baby. We are saying, see, cyclophosphamide is excreted via breast milk. So what you have to understand, because it can cause serious harm to nursing baby, do not take, this is where that whole reason why they are saying, do not take cyclophosphamide before talking to your doctor if you are breastfeeding. So if you are taking breastfeeding, you're not supposed to take cyclophosphamide is what they mentioned. So they are not saying it is because of this. Understood? So Christina happy, Neetu George happy, Kalyani happy, Tansi happy, Clay dancing, good enough. If you have any doubts with regards to whatever I have told you, please be kind enough to clarify. If not, be happy, isn't it? Enjoy. Sheena Korean clear, so thank you. Shiny, big gift. Thank you very much for that gifts. Betsy happy, dancing, good enough, enjoy. Kavita Balaji happy. God, see, you should enjoy your achievement. Let it be small, let it be big. You should be proud enough. So that is the whole reason. You have to say, yes, I got it. Right. Fair enough, even if I've got it wrong, do not worry. Why? You've been corrected. That's how you take it. And that's the power of learning. Josmi clear, Kavita, okay, fair enough. Because you don't have any doubts, I don't see anybody, now it is clear. Fair enough, thank you. Clear, and say, Tanga Sudha clear, okay, good enough. Because you don't have any doubts, are you all ready for the next one? What is next one? The next one is part A. So we'll go into part A. What is today's part A? It's called leap procedure. So I'm just telling you the heading, but I want you to tell me how you felt about the material and how many minutes you took in order to do the 20 questions. Leah, clear. Akila, clear. Betsy, tricky sir, took 13 minutes to complete. Fair enough. Anija, clear. Fair enough. So the first review I get from part A is from Betsy, who is saying tricky, but completed in 13 minutes. Good enough. Sandhya reading part A, clear. Asha, Akila Sham is saying tricky, 12 minutes. Savita is saying tricky, 14 minutes. Fair enough. So the first few review that I get from today's material is tricky. Reshma tricky, 19 minutes. Jilmi is the first one to say easy material in 11 minutes. Sidhu saying tricky, 15 minutes. Jean Bino tricky, 15 minutes. Fair enough. Arun Ravi, 14 minutes and 30. I always remember Arun will have a precise seconds counts as well. Good enough. Grishma Davis, tricky, took 12 minutes. Fair enough. B. Varghese, 15 minutes. Good enough. So the general review that I have out of what you have told me, it is tricky, but you're all able to manage time. So now let's go and dig part A. Okay. See, I want you to take your pencil and be ready. Tick. Took 14 minutes, didn't see, fair enough. As soon as the material pops up, we'll see what are the things that you have to really look for. And see, tricky material. So first and the foremost thing when you're doing part A, you have to always remember, I always tell my students to make sure that you don't do such kind of silly mistakes. See, when they place the material in front of you, do not touch the pencil, do not touch the material until they tell you to do so. As soon as they tell you to do so, do not waste a valid second. Be quick enough to open, start doing. As soon as they say stop, please do stop. But if you follow the tips and tricks that we have told you, you will always complete on or before time. Right. So what is the strategy? Strategy of part A is called skimming and scanning. Okay. Now skimming is quick look. Scanning is detailed look. How many minutes you have? You have 15 minutes to do 20 questions. Okay. So you have to always be cautious. And these 20 questions are divided into 3 types. 1 to 7 is called match the following question. 8 to 14 is called short answer question. 15 to 20 is called fill in the blanks question. So you will have 4 texts in part A. 4 texts will be based on one common theme, and today's common theme is leap procedure. So you have to skim. How much time should you take to skim? They say 1 to 2 minutes. I say 15 seconds. That's more than enough. As when you're skimming, you should be able to differentiate. Okay, text A is about this, text B is about this, text C is about this, text D is about this, even though it will be based on one. So when you're skimming, do not search for keywords. As you read, skim, underline the key words, not sentences. I'm just going to show you how to underline the keyword. LEAP may be done with the cervical and vaginal problems are found during the pelvic exam and abdominal cells and found in the TAP test. LEAP test is also to detect cancer in cervical or vagina. Cells are appear abnormal, but they are rare. Cancers are called precancerous, and these abnormals are the first evidence of the developed later years. LEAP may be used in the assisted diagnosis and treatment of the following condition: polyps, genital warts, and the infection of HPV. The risk factors of developing cervical cancer: 𝐼𝐡𝐴𝐧 DES ensure exposure. Women and mothers took DES during pregnancy, and DES exposure increase the risk of reproductive system. That's it. So what are they saying about LEAP? What are the other things that is there to assist the diagnosis? What is called precancerous. After, likewise, you have to go through each text. So the patient and the dorsal littoral position and insular speculum. So they're talking about different position. Then text C is about all the complications that can occur: intraoperative, postoperative, cervical stenosis, and cervical insufficiency. Then patient having. So they're talking about some study as well. Now done. After this, you're going to go to the question. I told you, you have to by heart this. 1 to 7 are called match the following question, where the instruction clearly says you are expected to write any of these letters A, B, C, D, and you may use any of these letters more than once. If your skimming is proper, that means underlining keywords. See, part A is only about keyword reference. You are expected to refer the keyword, that's all. Now, if you refer it properly, you can easily identify. See, what solution is used for a complete lesion visualization of the cervix? So where are they talking about? Definitely during that, there's a small issue. I'm not sure whether you're able to see the screen. Just give me a second. Right. I hope the screen is visible now. Okay. Now, see, solution. So definitely for me, I know when I skimmed, it is there in B. Now, is there in B? What is the solution? Leukold solution is placed on the cervix to visualize the entire lesion of the surgical. So that is it. You don't want to say what is it, but you should differentiate it, isn't it? So that's the biggest trick that lies there in part A. You have to really be remembering all these keywords. Not all, but that's why you are supposed to say what are the keywords. You have to memorize these keywords on the aspects. So these are headings, subheadings, proper nouns. Okay, these are the keywords. So that you can easily refer, and your underlining will give you a lot of insight to the answers. And indicative precursor for cancer may develop in the future. So I'm saying it is there in A. Now, precursor means a forerunner or a substance that worth another before it happens. So what are they saying? Cells that appear to be abnormal but are not yet cancerous may be called as precancerous cells. The abnormal cells are the first evidence of the cancer that could develop later. So that is why A. How many in the study group were diagnosed with invasive cancer? So when the study group and all, do you really need a second thought? Not needed. Invasive cancer, go see. Where are they talking about invasive cancer? Diagnosis of invasive cancer 11. Do you need it? No. So this is called managing time. Approaches to manage bleeding after a LEAP procedure. So after a LEAP procedure, where? Complication. C. I'm not going to worry about it. But because it is a class, so I have to tell you. So post-operative, after. That's it. Now, which medication may alleviate the risk of reproductive system cancer? So reproductive, where? I know that I have marked that word called in A. Now, where are they saying? So it is saying this 𝐷iethylstilbextrol exposure to women increase the risk of reproductive system of the cancer. So A, that's it. Now, rendering factors making patients unsuitable for both procedures. So rendering factors means something that is making these thing ineligible for both procedures. So both procedure again, 2. What are the factors? two procedures is there in D. Understood? So you have to really look into, so what rendering factors are the patients who do not satisfy the inclusion criteria. So these are the criteria that is making these two people not into that. So D. The lead procedure is most troublesome complication. So complication, do you really need a second thought? No, you're not asked which is the one, isn't it? You're asked only which text. So don't waste your valuable time. Complication C. So I have finished 1 to 7. Now the next set of questions are called 8 to 14. These are called short answer questions. So these short answer questions, you are supposed to, again, strategy doesn't change, okay? The instruction clearly says a word, short phrase. It can be anything between 2 to 3. It can be word or number or both. Arun 7, good enough. What consequence might ensue, develop if the loop's advancement is too slow? So consequence, ensue, develop. Sandhya 7, good enough. So where are they talking about? It should definitely be during it, isn't it? So what are they saying? Are they saying anything will develop? They are saying, see, this allows the cutting current to divide the tissue consistent forward destiny. If the loop moves too slowly, excess thermal damage may occur. So the answer is thermal damage. THERMALDAMAGE. Next question. Which? Now which means infectious organism is primarily responsible for a specific type of warts. So what specific type? Is there any place where warts are mentioned? There's only one place warts are mentioned, isn't it? Go to A. Why? Genital warts are there. So what is which one is causing it? See, human papilloma virus. But the safest bet is HPV because abbreviation is given in the text. So you can manage time. That's called being smart. What medical procedure was performed in 567 patients? So patients 567, go 567, laser conization. So LASERCONIZATION. In which phase of life women most susceptible to exposure to dietas? Again, go straight to A. Which phase? During pregnancy. So the phase is pregnancy. PREGANANCY. What percentage of cases reported cervical stenosis following a LEEP procedure? Now see, this is a bit tricky, isn't it? Now which phase? Report. It's not a study in the report because there is a report which is mentioned just above it. So probably the most concerning cervical stenosis has been reported, keyword number 1, to be between 4.3 to 7%. So the answer should be written as 4.3 to 7% is the answer. Because percent is needed, because even though percentage, if you write 4.3 to 7, it's not depicting percentage. Okay, there is no word in English called 4.3 to 7%. No, it should be with the symbol. If you have not yet written the symbol, please do mark it as wrong answer so that you do not make the same mistake. To achieve thorough visualization of the lesion during procedure, what is the expected amount of acetic acid to be used? So acetic acid, where? Go to B. Acetic acid 3 to 5%. Straight answer. Because you're not asked anything. Acetic acid 3 to 5%. Good enough? What heightened risk is noticeable across all gestational ages after LEEP procedure? After LEEP procedure. So where are they talking about after LEEP procedure? C. Complication. Go. So what are they saying after? Where is it? So what are they saying after? They are saying a lot of, what is going to happen? Saying a lot of preterm delivery is going to happen, isn't it? Why? So in case of large study published, found increased risk of preterm delivery, all gestational ages following. So preterm delivery, PRETERM DELIVERY. Now for the final set of questions, these are called fill in the blanks question, where the instruction remains very similar. Okay, I'm sorry. Instructions remains very similar. Okay, word, short phrase, words, numbers, or both. Anything is okay. Strategy doesn't change. You're going to underline the keywords because part A, purely keyword reference. Among the cohort, that means the study, 40 patients did not get included as their follow-up years were less than dash. So, study, follow-up year less than 5. So, the number 5 should be given. The less than symbol is given as a word in the question. So, the answer is 5. Careful manipulation of loop is essential, ensuring 𝐴𝐶𝐵 passes beneath the transformation zone, excising a depth of dash. So again, something to do with some numbers. So go to B, because all the loop carefully simulate around excise at the depth of 5 to 8 mm. So 5-8 mm. Abnormal cells. So abnormal cells where? Go to A. Potential as initial indicator. Latent condition manifest here. So definitely it is there, abnormal cells. It is called precancerous, isn't it? PRECANCEROUS. To visualize the entire lesion, aid surgeon in selecting the dash appropriately, acetic acid and lubricants. So go to B. Now you have to see what is missing. So what is missing? Loop electrode. LOOP ELECTRODE. The penultimate question for today. An extensive dash of 20 studies indicated no rise in perinatal mortality, lower occurrence of preterm delivery before 7 months. Now 7 months, I've never seen anywhere 7 months. But let's see what the other keywords and all. 20, yes, 20 days is here. Less than 28 weeks, that's where that 7 months is paraphrased. So what is happening there? A meta-analysis is the only thing which is missing. So the answer is a hyphenated word. Please ensure that you're writing with the hyphen, meta-analysis, META-ANALYSIS. The ultimate question for today, hemorrhage, bleeding, occurring promptly post-surgery, often stems from warning effects of dash or not sufficient intraoperative hematostasis. So what happened? So all those bleeding, where? All those things. Again, it should be somewhere in the complication, isn't it? So bleeding, what is that? So go to post-operative thing. Is it saying, yes, bleeding is there, hemorrhage is there. All the others are inadequate, intraoperative hematostasis, and all those things are there. What is missing? Vasoconstrictor solution. VASOCONSTRICTOR, vasoconstrictor solution, SOLUTION. So I have wrapped my 20 answers. Now if you have any doubts, please be kind enough to clarify. If not, do shoot me your total scores. Eagerly waiting to see. If you have any queries, please do. If not, let me know what are your total scores. 𝐷𝐶𝐲, the first one to say 18 out of 20. Very good. Keep it up. 𝐷𝐶𝐲 18. Very good. Keep it up. Good enough. Good enough. Sophia 17. Good enough. Good enough. Sandhya Vijay 20 out of 20. Absolutely good enough. Very, very, very good. Keep it up. Good. Good. How about others? See, it's about you letting yourself know where you stand. It's not for anybody else. Okay? Do not worry, oh my God, what will others think? Others have nothing to do in our life. Because this is your ability. You know where you are and you know how you're progressing. That's enough for us. Arun Ravi 18. Good enough, good enough. Keep it up. Any other doubts? Anything that you want me to clarify? Eighteenth answer is very simple. Loop electrode. LOOP ELECTRODE. And you get that from B. Akila Sham 20 out of 20. Very, very good. Keep it up. Good, good, good. So, good enough. So, I don't think that there is any doubts other than that. So, I would definitely take a leave because as we are all a family, our job is to make sure that you're all benefited. I hope it was another lovely session for all of you. I don't know. You have to let me know. But for me, it was again another lovely session to meet a lot of people in front of me, even though virtually. Love to meet all of you. So, until and unless I see you all tomorrow, adios from me.